Chapter 16, Periodontal Disease. Periodontal disease is an infectious disease process that involves inflammation of structures of the periodontum, causes a breakdown of the periodontum, resulting in a loss of tissue attachment and destruction of the alveolar bone. Periodontal disease is the leading cause of tooth loss in adults. 47% of adults and 30 plus have a form of periodontal disease, and 70% of adults 65 plus. Almost all adults and many children have calculus on their teeth. Structures of the periodontum include gingival, epithelial attachment, sulcus, periodontal ligaments, cementum, and alveolar bone. Bacterial plaque or dental plaque and oral biofilm, calculus, and tartar provides a surface to which biofilm can attach. There are two types: supragingival calculus, found above the margin of the gingival, and subgingival calculus, which is on the root surfaces below the gingival margin and can extend into periodontal pockets. Chronic inflammatory periodontal disease may significantly affect health conditions such as coronary heart disease, stroke, or preterm birth. Chronic inflammation appears to do harm to the entire body. Certain systemic conditions increase the patient's susceptibility to periodontal disease. Periodontal disease may actually increase a patient's susceptibility to certain systematic conditions. Cardiovascular disease: individuals with periodontal disease have a greater incidence of coronary heart disease. Preterm low birth weight: women with severe periodontal disease have 7 times the risk of preterm low birth weight infants. Respiratory disease: individuals with periodontal disease may be at increased risk for respiratory infection. Inflammation caused by an accumulation of bacteria in the biofilm. Disease-causing bacteria are necessary for periodontal disease to occur, but they are not totally responsible for the destruction of periodontum. Other risk factors alter the body's response to bacteria that are present in the mouth. Periodontal disease is an inclusive term describing any disease of periodontum, including the following: gingivitis and periodontitis. There are 4 stages, starting with gingivitis, early periodontitis, moderate periodontitis, and then advanced periodontitis. Gingivitis is inflammation of the gingival tissue. Categorized by areas of redness and swelling, there's a tendency for the gingiva to bleed easily. This is limited to the epithelium and gingival connective tissue, no tissue recession or loss of connective tissue or bone. Most common gingival disease and easiest to treat, and can be improved with daily hygiene and can be reversed. Periodontitis means inflammation of the supporting tissues of the teeth. Extension of the inflammatory process from the gingiva into the connective tissue and alveolar bone that supports the teeth. Progression of periodontitis involves destruction of connective tissue attachment at the most apical portion of the periodontal pocket. In 2017, the American Academy of Periodontology developed a new classification system for periodontal disease. Staging system, grading system will help clinicians to develop a comprehensive treatment strategy based on the patient's specific needs. Stages 1 through 5: severity, complexity, and extent of distribution. Grade A, slow rate of progression; B, moderate rate of progression; and C, rapid rate of progression.